Now we want to proceed to scanning the left kidney, first in the longitudinal plane. The position of the transducer is in a left lateral position, in the left lower intercostal space. And here we get a picture of the left kidney in the longitudinal view, the renal pelvis in the center, parenchyma, and a neighboring organ, the spleen. And dorsally, again, we can see the psoas muscle. A scan of the left kidney, the spleen over here, and the renal pelvis, the renal parenchyma. Our approach to the left kidney is from the left lower intercostal space. And we remember that the left kidney is positioned more cranial than the right one. So we have also to position our transducer a little bit more cranial. Again, we ask our patient to turn on his side, this time in a right lateral position. It's easier when he has lifted his arm up like this. And we try to find the left kidney with the transducer in the left lower intercostal space. And it's about in the posterior axillary line. And as you can see, I try to get in between two ribs because I'm a little bit more cranial. I ask my patient to inhale again. Please inhale. Now let's see if we can get a glimpse of the left kidney over here. And again, when I've got a piece of it in my view, I turn my transducer slowly. Exhale and inhale, please. I turn my transducer slowly to get again the longest diameter. Over here, I press my freeze button. Thank you. And now we can again distinguish the renal pelvis in the center, hyperechoic as we already know, and the renal parenchyma over here. The marked pyramid, the cortex, and the renal capsule. Again, we can take a measurement. The longitudinal diameter, 11.9 centimeters, perfectly normal. And the transverse diameter, about 4.8 centimeters, which is also normal. Again, when we've got the longest diameter, we have to scan the whole organ in this plane and ask our patient to inhale again. We got the longest diameter. We tilt our transducer to the left and to the right, slowly. And as you see, I have to correct the position a little bit of my probe to keep a longitudinal diameter. Again, I perform this movement slowly for you. Exhale and inhale again. Longest diameter. Then I tilt my transducer from one side to the other and hold the kidney in the center of my picture so that I can assess the whole left kidney in the longitudinal plane. Now the transverse view of the left kidney. Position of the transducer is of course in the left lower intercostal space again. Just turn our probe around 90 degrees and get a transverse view of the left kidney, the pelvis in the center, the renal parenchyma over here. A video clip of a transverse view of the left kidney. You can see here the left kidney and the spleen as neighboring organ. When we have assessed the organ in the longitudinal plane, inhale please. We got the longest diameter, and a good picture of our left kidney, we turn our transducer again into the transverse plane. Slowly, slowly, anti-clockwise. And keep the kidney in the center of a picture again. Exhale, please. And inhale. Okay. And here we got a picture of the left kidney in the transverse plane. In the center, the renal pelvis. Around it, we can see the renal parenchyma, the renal capsule over here. A piece of the spleen. And this is a rib shadow. So the left kidney is sometimes not so easy to scan in the transverse plane, but the patient can help us a lot. Inhale, please. So we can use the breathing movement of the patient to help us scanning the kidney. Exhale, please. Now you can see this picture is a lot better. We've got again the parenchyma and the bright hyperechoic renal pelvis in the center. Here the spleen. And again, we scan the whole organ in the transverse plane, so we have to tilt our transducer upwards and downwards. But we stay in the same axis of the left kidney. Keep it in the center and ask a patient to breathe in. Inhale. Tilt our transducer slowly, slowly upwards and downwards. So the lower pole of the kidney disappears. And then we tilt it again upwards until we can see the upper pole of the left kidney. Exhale, please. As you can see, the patient can help us a lot. Breathe in. Inhale. Of course, the kidney moves with the breathing of the patient. So I show you again the movement. Tilt the transducer downwards and upwards to scan the whole left kidney in the transverse plane too. The normal diameters of the kidneys in ultrasound are about 10 to 12 centimeters in length and 4 to 6 centimeters in transverse diameter. The width of the parenchyma should be at least 13 millimeters. Up to 25 millimeters is normal. And we've got another measurement, the PP index, the parenchyma Pyelon index. And it shows the ratio of parenchyma to the complex of the renal pelvis. In degenerative changes of the kidney, the renal parenchyma gets smaller and gets atrophic, whereas the renal pelvis won't. So the relationship between parenchyma and pelvis shows the degree of atrophic changes. The parenchyma Pyelon index changes physiologically with age. When scanning the kidneys, we've got obstacles that can block our view and maybe lead to wrong measurements, the ribs. It's because bones cause complete acoustic shadowing behind them. Also, meteorism can be a problem because colon gas extinguishes our ultrasound beam. An oblique view of the kidney can maybe show us wrong diameters, and an unusual position of the kidney can make it difficult to find the organs. And sometimes we can't find one of the kidneys even if we try all tricks. And when we're already desperate, maybe our patient tells us that he forgot to tell us he had undergone surgery and one kidney has maybe been removed. So in any case, it is helpful to ask the patient if he or she has undergone any abdominal surgery before we start the scan. Problems are of no help to us. We need solutions. Our tips when scanning the kidney gets a little bit difficult are: use different approaches, try different intercostal spaces, let the patient turn to his or her right side and even into prone position. Consider the curve of the ribs when positioning the probe and try to get into the intercostal space. And when you've already found a part of the kidney, move and turn your probe slowly until you get the longest diameter in longitudinal plane. And you can also let the patients help you if they can, not only with turning to the sides, but also with their breathing. Since the kidneys move with the breathing of the patients, we can eventually overcome a blocking rib shadow.